In order to deal decisively with Ebola in the event of an outbreak, the Ministry of Health has set up 4 laboratories that will be used to test samples of Ebola cases. This is part of the country's preparedness as it rolls out preventive measures following the confirmation of cases in the neighbouring countries, DRC and Uganda. And as Milia Kisienya reports, India has reported its first suspected case of Ebola after a woman who travelled into the country from Uganda developed symptoms that mirror the global contagious disease.
As the outbreak of the Bundi-Bujo strain remains on high alert in DRC Congo and Uganda, the Ministry of Health in Kenya is passing up and down to ensure it contains the highly contagious disease from spreading into the country. 4 laboratories have been set up that will oversee the testing of samples of any suspected Ebola case in the country. Confirming this was Public Health PS Mary Modoni, who also noted that at least 800 health workers have been trained and sensitized on ways to deal with Ebola.
4 laboratories now that can test for Ebola. National Public Health Laboratory. We have KEMRI Nairobi, KEMRI Kisumu, and mobile laboratories because we remain a high risk of importation. We have put together the personal protective gears. We have coordinated with our partners to also make sure that our healthcare workers are protected.
Meanwhile, a woman has been placed in quarantine in the Indian city of Bengaluru with a suspected case of Ebola after she traveled to the country from Uganda. The 20-year-old woman developed body ache after she arrived in Bengaluru in India. An initial sample sent for testing came back negative for Ebola, but health officials insist she will stay in isolation until she has tested negative a second time after 48 hours. According to the latest report from the WHO, the Bundi-Bujo strain of Ebola virus has impacted both in DRC Congo and Uganda with over 900 suspected cases, 223 suspected deaths, 112 confirmed cases, and 11 confirmed deaths. In DRC Congo, there are about 105 confirmed cases and 10 confirmed deaths, all within Ituri, North Kivu, and South Kivu provinces. In Uganda, 7 cases and 1 death have been confirmed, with 5 of those cases confirmed as a result of contact tracing following the first 2 cases. The Bundi-Bujo virus progresses as a sudden fever, severe headache, muscle pain, fatigue, vomiting, diarrhea, and unexplained bleeding or bruising.
Ukisikia kwamba uko na kichwa kinauma sana, ama unatapika, unasikia kuchoka, please enda katika kituo cha karibu cha hospitali ili uweze kupimwa. Ugonjwa wa Ebola ni ugonjwa hatari sana.
With no vaccine available, local authorities and humanitarian partners are relying on IPC practices, community education, and rapid hotspot identification to stem the outbreak.